And most of the numbers that we bring you every day come either from the state or local county health departments. But now Texas has made a decision to change how it is going to calculate the number of deaths. Andrea Lucia explains what's different. All new at 10 o'clock.
The official death toll in Texas from the coronavirus jumped today by 675. Only 44 of those deaths are new. The rest are the result of a change announced just today in the way the state counts and reports deaths.
The idea really is to improve the data that we're able to produce.
Chris Van Dusen with the Department of State Health Services said instead of relying on reports from local health departments, it's turning to death certificates to see what doctors and coroners have determined as the cause of deaths.
So this is going to let us be consistent. We're using one data set for the entire state. There are clear deadlines for when those reports have to be filed, when the death certificates.
Death certificates also allow the state to better track the age, race, and ethnicity of victims. Dallas County reported the death of 17-year-old Jamila Barber from COVID-19 back in April. But until today, the state's website didn't show any Texans under the age of 20 dying. Now it shows at least 8.
We do think that there's been some slowing down of things.
Meanwhile, in Dallas County, Health Director Dr. Phil Huang blamed a glitch in the state's electronic reporting system for large dips and a spike in its daily case numbers. The county's epidemiology team this weekend noticed reports from one lab hadn't been included for the past week. Roughly 400 cases were then added Saturday, causing the county's largest single-day increase ever.
We're trying to work with the state and make sure that this gets smoothed out. Sometimes there have been issues just getting these reports through the system.
Another change we can expect to see soon is the reporting of probable COVID-19 case numbers. They'll include, among other things, cases where somebody has tested positive for antibodies to the coronavirus. Dallas County says those numbers will be kept separate from the confirmed case numbers. In Dallas, Andrea Lucia, CBS 11 News.
Andrea, thank you. There are some positive signs in Dallas hospitals we want to share tonight. These numbers coming from 25 hospitals throughout the city. In recent days, the percentage of hospital beds occupied, ICU beds occupied, and also ventilators in use have all dropped. So a good downward trend there. Governor Greg Abbott is also sharing this graph from the COVID tracking project. This compares Texas to Florida and Arizona, and it shows a clear drop here in Texas over the last few days in the positivity rates. Governor Abbott says, quote, Texans are doing great, but that COVID hasn't disappeared, and urges everyone to keep using masks, keep safe distances, and when possible, stay home.